Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Good morning, Dr. Luper.
Morning, Haley. How are you doing?
Good. How are you?
I'm doing great.
Good. So, you've been busy, not only in the practice, but you're also working with legislators to pass a very important Senate bill. And it's not the first time. How long have you been at this?
Well, I've been working on legislation to permit naturopathic doctors to prescribe here in Alaska for about 20 years.
Yeah, that's a pretty big piece of legislation.
Well, it's big if you're a patient and you don't want to have to go to another doctor to get a prescription. The weird thing about prescribing in Alaska is that naturopaths can't do it. Now, they can in most other states where they're licensed. They can in Washington, Oregon, California, Arizona, Idaho, Montana, a bunch of other states as well. And they're trained to be able to prescribe. But here in
Training as in, like, going through pharmacology, understanding, like, what medications to prescribe, with what.
Yeah, let me just say how the system's set up. The way to prescribe, no matter what the profession, they're all the same. The way to prescribe is you have to take classes and you have to learn about drugs and how to prescribe. You have to learn what to avoid not giving together, what things do, why they work. There's a bunch of knowledge that goes with doing this. Then you need to take that knowledge out in the real world and practice. And you need to practice under the supervision of experienced doctors. People can look over your shoulder, make sure you're doing a good job, make sure you're not making any mistakes. And then when you're done with that, you have to take a big test. You have to take typically it's just a national licensing exam. And the purpose of the test is to make sure that you're competent, and then you won't, make any mistakes and hurt anybody.
Yeah, you won't prescribe the wrong medication and have somebody OD.
And that's how
on
the
your
system
hands.
is. That's the way it's set up for all the professions that prescribe. Every single one of them does the same thing, including
Naturopaths.
NDs. Same thing, same system. Now, the weird thing is here in Alaska, we're not allowed to prescribe. And there's no good reason. It's mostly just an accident of history. Well, I don't know, accident's the right word. I'm being overly nice. The reason is real straightforward. It's because the MDs and DOs to some extent, basically, people can prescribe right now, block it. Let me be more specific. The Alaska State Medical Association is adamant in their opposition to allowing naturopathic doctors to prescribe. Adamant. In fact, it's so adamant, I wonder why. I really do. I've been thinking about this for a long time. Why are they so passionate about trying to block naturopathic doctors from prescribing? Now, if you talk to them, what they'll say is this is the number one issue for the State Medical Association, is to block the prescribing of naturopathic doctors. Number one.
Wow.
Isn't that amazing? There's a lot of stuff going on in Alaska.
Yeah.
A lot of health problems. I wouldn't say this is the number one, no matter how you sliced it, because there's a doctor shortage. And that is, actually getting care is a much more important.
It's so difficult in Alaska. There aren't doctors that come up here.
There's not
and wanna
enough.
Practice.
The numbers of doctors are going down.
Right. And then the number of naturopaths in the state of Alaska
Is also going down.
Is also going down because they can't come here and practice their full scope.
Yep. That's a fact. Naturopathic doctors are trained to prescribe, and to move into a place where you can't prescribe is like moving to a place where you have to put one of your hands and tie it behind your back, and you can't do the things that you're trained to be able to do. And so it's very hard to recruit naturopathic doctors to move to Alaska. Now, in the past, what was a great advantage of recruiting was the fact that Alaska has insurance equality. That is, insurance companies that provide, coverage here in Alaska have to provide for naturopathic care. They have to cover naturopathic care. And so a naturopathic doctor could make a living by charging insurance. Whereas other places, for a long time, you couldn't. The insurance companies wouldn't cover naturopathic care. Now that has since changed because the number of naturopathic doctors has gone up. The need for naturopathic care has gone up. there's been a sea change really in the nation in terms of naturopathic coverage. And so you don't have to move to Alaska to get coverage anymore. Alaska was a pioneer. That's not the case anymore. All the states I just mentioned all have insurance coverage, every single one of them.
Yep.
And so you could just stay in California or Oregon or Washington or Arizona, wherever you want, and just get the insurance companies to pay. And so that has stymied the influx of naturopathic doctors into Alaska severely. And right now, there's about half as many naturopathic doctors practicing as there was at the peak. And that was maybe, I don't know, 15 years ago, something like that, pretty close to that.
How many were there 15 years ago?
About 80.
And now there's only about 40.
Yeah.
I only know of you in town, essentially. Are there any other naturopaths in Fairbanks?
Yes, there is. What's happening in Fairbanks, what's happening is a microcosm of the whole state.
Right.
What's happening is we're aging out.
Yeah.
A bunch of names come to mind, and are they practicing? Kinda. What they're doing is they're lowered their practices, or they're seating fewer people, they're commuting, they're doing a bunch of kind of things. So I give you a long list of people who are practicing here in Fairbanks, except for, are they actually practicing? No. They're very little and they're on their way out.
Yeah.
They're retiring is what they're doing. They're in that kind of in-between phase where you go part-time just for the fun of it more than anything, because you don't want to leave people hanging, and there's no place for them to go. So if you're going to retire, I mean, it's a moral quandary.
Right.
Because where are you going to take your patients? Where are you going to put them?
Right.
There's no place to put them. And it's really a problem. It's hard for patients to find a place to go. We have that problem here. We have this situation where it takes, weeks to months, depending on exactly where in the year we are.
Yeah, a couple months back, like
2 months.
November was pretty bad.
Yeah,
but
2 months. Just a few months ago, it was about 2 months to come see me. Right
Yep.
now, the waiting list is about 5 weeks.
5 weeks.
So that's a long time to wait if you're sick.
Right.
Right? We get a
Right.
patient we were just talking about before we started the show. A patient came in with a tumor on her neck.
Yep.
It has doubled in size in a week.
A week, yeah.
And she can't get in to see me, except for I have to see her at lunchtime, which we'll do.
Yeah.
We'll do. We set it up. We'll see her at
Absolutely.
lunchtime. But it's that kind of thing, trying to fit in patients because everything's so busy. Now, it would be helpful if we could actually recruit naturopathic doctors here at Alaska and share the workload. And I could. I mean, I've done it. I've trained 18 young doctors on how to be doctors doing residencies and various things. And so we know how to do it. We certainly have done it before. But what we need to do is get this law passed so that they can practice like they're trained to practice. Now, again, let me review what I said before, which is the way the system should work. The way the system works, normally is you take the class, you practice, you take the big test, you get safe, then you get licensing. And
Yeah.
then you're good to go.
And then you practice under supervision.
Right.
Yep.
Well, while you're practicing, you're doing the practicing under supervision, while you're a student doctor,
Right.
a resident or student doctor. And that doesn't happen here in Alaska. That's being blocked. And the reason is I'm not exactly sure here. The reason that the asthma gives is naturopathic doctors are untrained and unsafe, which is actually not true. They are not untrained and unsafe. They are well-trained and very safe.
And I mean, in my experience with naturopathic doctors, which is only with you in the past 3 years, you have been very cautious as to dosages, as to what herbs you're prescribing, as to what amounts they're taking. Everything is taken into very high consideration. And from my perspective, naturopathic medicine is a way that patients can take their healthcare into their own hands.
Yes.
It's not relying on medication, it's not relying on procedures, it's actually a way that they can be autonomous in their own care.
Yes. Yes, it's true. I think that's the real problem. I don't think it's the safety record. They're just making noise because the safety record is excellent. The safety record is better than MDs and DOs. You
Yeah.
really get down to it, what is the actual safety record? Because there are many states that allow NDs to prescribe.
Mm-hmm.
So there's a safety record that's already in the world that you can look at. This has been done for, decades or up to 100 years, depending on what state you're looking at. And the safety record is excellent. It tends to be, the excellence is not good enough for it. What's the actual record of mistakes? It tends to run 10% of what the MDs and DOs have. Now that's not 10% because there's just 10 times more NDs. We're talking per capita. Like you take 1,000 doctors and you'll have 2 mistakes, and you compare it to, or 10,000 doctors and you compare it to the NDs. The rate per number of doctors is 10% than it is for MDs. Okay, and that's one thing. But even a better way of measuring the safety record is looking at malpractice insurance costs. It's way cheaper to insure a naturopathic doctor than it is an MD or a DO.
And so even if...
Same thing, 10%.
10%.
The cost of malpractice runs about 10% because the risk runs about 10%.
And so even if this bill were to be passed, how would you and other naturopaths be able to use pharmaceuticals in their practice? I thought that, naturopaths were not to use pharmaceuticals, or they would rather not. They would just use different modalities.
Yeah, so that's a good question. Let me restate your question. You're an naturopathic doctor. What do you want to use drugs for?
Yeah, I mean, the herbs we use, those can be drugs.
Are we just going to be like those guys and do the same thing? We're doing this other thing. The answer is there are situations where drugs are best. That's the simple answer. There are situations where you can't get an herb that'll do what a drug will do. Now, there's a lot of situations where an herb is best, and an herb will do better than a drug will do. So it goes both ways. But the fact is, some herbs don't do what some drugs do. Let me give an example. If somebody comes in with a thyroid gland that's not working correctly, they need thyroid hormone. You can't get that out of soy.
Or stimulating it with all the herbs.
No, you can jiggle someone's thyroid with herbs. Lycopus is helpful. That's an herb that's pretty good. It's good. Anyways, there are some herbs that are pretty good about stimulating a thyroid that's not dead.
Right.
But you got a thyroid that just doesn't put
dead
out hormone. Forget it. You need that hormone.
You need the hormone.
You got to get that from an animal source or manufactured.
Other ways that I could think it being effective in practice would be like IV therapy. Yep.
So a lot of times you want to get nutrients into people and their digestive systems that isn't working right. You really just want to put it in, heavy duty and turn a case around. This is a super useful thing to be able to do. Once you take a nutrient like vitamin C or magnesium or something like that, and you turn it into an injectable, it's now a prescription item. And so you can't, here in Alaska, we can't do injectables.
Nope.
B12 is another one. It's a super safe vitamin, and you can't give a B12 shot. Now, we did before because B12 is not, you can get B12 over the counter.
Uh-huh.
And so for years and years and years, naturopathic doctors did injections, and they did IVs, they did all kinds of things. We had a wing set up at our clinic. I'd say, a third of the clinic was devoted to doing IVs and treating cancer patients mostly. And that all got shut down. We took it all the way to the Supreme Court here in Alaska and lost. And the Supreme Court said, we're not going to legislate this thing. This needs to be changed. The naturopathic doctors need to go to the legislature and have them change this. And so we did, and then the MDs and DOs, basically the State Medical Association, came out against us and blocked it. Managed to convince enough people in the legislature that it was a bad idea and not to do it. Now, the thing that I always thought initially was this is just a case of misunderstanding. That once the State Medical Association realized what the true safety record of naturopathic doctors is, they changed their mind. Once they realized what the true education is and what the true quality that goes into doing the national board exams, once they understood these things, they would just change their mind because they just didn't know. They thought that naturopathic doctors weren't trained. And so I made great efforts to educate them. Did so. Actually had a meeting where we brought experts in from all across the country. Experts in education, experts in training, experts in licensing, experts of all different kind of types. And into that process, nothing happened. No one's mind was changed one bit. Literally, it was not changed a bit. It was an utter shock to me because I thought, well, now this will take care of it. And it had nothing to do with the reality of the safety record of naturopathic doctors. I'm going to say that again. The opposition from the State Medical Association here in Alaska has nothing to do with the reality of the safety record of the naturopathic doctors, because that reality is that they are safe, have been safe, and continue to be safe. The reality of this thing, and here's what I'm really thinking hard of. This is me thinking, trying to imagine why this is happening the way it is. I think the reason that there is such opposition to this bill is because there is a sea change in medicine upon us. Because so many people don't like the heartlessness and the big pharma approach to medicine. They feel like they're being cheated. They feel like they're being hurt. They feel like that people don't care about them and they're just making money off them.
Yeah, you go in. I've heard so many patients come in here and tell us what's going on with them, what they're experiencing. And when they go to a hospital and do the same thing, then they're referred to so many various procedures that have nothing to do with the condition that they're dealing with. And it's just so that they can bill insurance and make that money.
You know, I'm sure some of that is true. I'm also sure that there are people in medicine that have huge hearts and do care about their patients and really put it out there. I know some of these people. I don't want to bash MDs and DOs at all because they're excellent people. They do great work. But in the world around us, there's a feeling like they're not doing it right. Not with everybody. Lots of people just will take their pills and call it good.
And I think that a big portion of that is based on the individual itself, the patient itself, where a lot of people, we're not doing it right. We're not taking care of our bodies. We're not eating healthy food. We're not exercising. We're not getting adequate sleep. We're not drinking enough water. So in my eyes, naturopathic medicine is more of a preventative method to keeping your body whole and healthy so that you don't have to go down the road of pharmaceuticals.
Yeah, the most interesting question to me is how to be healthy.
Yeah.
We have done so many shows on this because it's the most interesting question.
Yeah.
Is how to be healthy. So we're not doing shows on epilepsy and we go into various drugs and here's one that works this way, but the side effects are this, and here's another drug that works another way. The side effects of this, you start with the one and you go to that. I mean, we could do a show on that. That's a fairly interesting show. How do you manage epilepsy?
But I have a very dear friend with epilepsy, so I would be interested.
Well, the more important thing for me is how do you not have epilepsy? What can you actually do in reality to make epilepsy go away? If the drugs don't work, and occasionally they don't, is there any alternative? And the answer is yes, there absolutely is. We should do a show on epilepsy because it turns out there's this whole other thing that most people don't do. Now, the doctors...
Well, I think that's a great point, too, is if the drugs don't work, then what can we do? And that needs to be kind of a mindset overarching of all of our patients, that keeping in mind these drugs might not be your end-all be-all. They might not be the solution. So what's going to work? What is going to be the behavior change? What is going to be the lifestyle change that you incorporate so that either the drugs can be more effective or that you find another route and you don't need drugs at all?
Yeah. So when I imagine myself looking through an MD's eyes or through the people that run the State Medical Association, it's this question right here I think that they can feel. They can feel this pressure in society against this big pharma, heartless medicine thing. And the naturopathic doctors, there's only 40 of us in the whole state, right?
How many are there in the country? Do you
Thousands.
know that?
So
Okay.
nonetheless, it's a drop in the bucket. It really is such little impact because, let me just keep it simple. So it's a symbol. It's a symbol of the feeling that they feel threatened, and we are something they can do something about. So they want to stop naturopathic doctors from prescribing because they want to feel better about their own profession.
In Alaska, it's just so controllable because there's so little.
Yeah, it's not just about naturopathic doctors. Let's be clear about that. Naturopathic doctors don't have a monopoly on common sense by any means. They don't have a monopoly on getting to the bottom of things, right? And treating people with compassion. Absolutely not. There's all kinds of doctors of all walks of life that are doing that. People doing alternative medicine, people doing regular straight allopathic medicine. There's a lot of good doctors in the world. But there's a feeling that there's something wrong. There is a feeling right now that things aren't being done correctly. And that has gone all the way to the national level. This thing where, people taking over, Kennedy's taken over, a lot of the reason why this has happened is because there's this groundswell of anti-regular medicine.
Pharma, yeah.
Yeah, and so how they want to put it as there's scientific medicine and there's everything else. And that is not the case.
It's so funny to me that people think this naturopathic medicine is alternative medicine when really it's original medicine. This is where medicine originated.
It's absolutely scientific because that's what I look to when I make decisions as a physician. I look at what the research tells us. So if the research says that something doesn't work, or my own experience says it doesn't work, I don't use it. It's not a religion. I'm not trying to make a point. I'm not trying to come up with some kind of foo-foo thing and, dazzle people. That doesn't mean anything to me. What I want to do is actually do things that work for real, like deeply. And so what I'm looking to is the research. What's the research say about it? For example, the research says that exercise is one of the most powerful tools we have to treat cancer.
Yep.
That people who exercise have much better outcomes. And what do we mean by outcomes? That means they stay alive. The death rate is lower than people who exercise. Well, that's interesting. How does that compare to chemo? Turns out to be about the same. The effectiveness of exercise, the effectiveness of chemo turned out to be very similar to one another. Now, I'm not against chemo. I think chemo's great. I'll say that again. Chemo's fabulous. In certain situations, it can save people's lives. It's great. But what about this exercise thing? Now, the problem with exercise is the population, on the planet that's least likely to exercise, people undergoing chemo.
Right.
So they're going to need some encouragement.
They're going to be drained. They're going to be absolutely tapped. They're going to be energetically...
How do we do that? And the answer is carefully. So I have some patients who are undergoing chemo, and I have them buy a rocking chair and rock, because the rocking motion gets blood flowing, and then the chemo works better with that. Because that's all they can do is rock in a chair. Now, is it a waste of time? No, it's not. Because what we're looking for with treatment, particularly with cancer treatment, is to get the percentage chance that you're going to survive this thing to go up.
Yeah.
Now, if your chance of surviving this thing is 10%, and we can get it to 20 by you exercising and, taking some herbs and doing some other stuff, not eating sugar, whatever, stuff like that. You just doubled your chances of survival. Now, does that mean you're going to survive? No, but we can look to the research to guide us, because the research has been done a lot of times. These questions have been asked and answered. What's the percentage chance that you're going to survive this based on the things that you're doing, based on the research? So it's not a question of scientific or not scientific. That is actually not true. That is not what's happening. What it's a question of is the system we have now and the people who don't like it and this groundswell of opposition.
And then the people who don't like it, who come into our clinic, I have seen you countless numbers of times say, okay, how can we work with what you're doing there? How can we work with your oncologist? How can we work with your chemotherapy? How can we keep your body healthy enough to sustain the chemotherapy so that you don't get sick from the chemo, so that you don't get sicker from the cancer?
Right.
So
the vast majority of times what I'm doing is actually working with the oncologist and trying to just get everything to work better.
Yeah, not even cancer. You do it with diabetics.
Or
you
whatever
do it
the
with,
disease is.
Yeah, you do it
occasionally, rarely, chemo doesn't work. Mm-hmm. And we got to try something else because chemo is just not effective. And we have people alive and well now who chemo didn't work, and they've changed their plan and they're doing stuff and now they're living, and it's fabulous.
Yes.
Very satisfying, very satisfying. I mean, geez Louise, I'm one of those people.
Yeah.
With my lymphoma. My lymphoma is not treatable by chemo. It just isn't. It doesn't work. Everybody knows that. And yet here I am, keep living and doing well.
And you are the most active person for your age that I know. You're telling me of all these bike rides you're going on with your dogs and
living
through
life
the
well.
hills,
That's
through
bottom
the
line.
snow.
Living life well, having fun, having adventures, doing all kinds of fun stuff. Right. Well, and so I'm very interested in how to do that, in the science behind how to do that. And now here's the thing. Let's go back to the point here, which is we have patients that come in who need medications. They just do. They either need medications because there's no herb for what they got,
or they need a continuous glucose monitor, or they need a CPAP machine.
They need things, right? Things.
Yeah.
They need something that is a prescription item. Mm-hmm. And so I am trained Me and my colleagues are trained, well trained to provide this service. This is a service that we could provide. It's needed. And right now, what I have to do is I have to send those people away.
Which is, nobody else can take patients. Everybody...
And no one else can take it. Basically, what I'm doing is I'm saying, look, I don't know what to do. There's no solution to your problem. I guess you could go to the emergency room, but it's going to cost you a fortune. I mean, the system is broken. It really is. It's absolutely broken. I don't tell people to go to the emergency room. I try to come up with a more realistic solution. But we struggle to send people somewhere else where they can get a prescription. And the people that I do work with are just more booked out or more booked out than I am. And so we got to come up with some kind of weird thing, and who knows what we come up with. Just cobble together some sort of solution. This would all be a lot easier if I could write a prescription, just send you down to the pharmacy.
So how can patients help support this bill? What bill is it? There's one or there's two?
There's two of them. There's a House version, there's a Senate version. The House version is HB, that's House Bill 147. And the way to support this is to write a letter in support of the bill. And the person to write the letter to is Mike Prax, Representative Prax. He's out of North Pole. And he is our prime sponsor. And any letter that you can write in support for this thing and send it to him. We could, I don't know, there's some way to get an address or something to make it easier for people to do this. Anyways.
Yeah, I mean,
Representative
listeners,
Prox,
can go on to the Alaska website and look up their addresses.
There's a Senate
available
version
online
as well. Scott Kawasaki, Senator Kawasaki, is prime sponsor on that. It's Senate Bill SB 193 is what it is. Same story. You can send a letter of support to Senator Kawasaki. The letter really should say that my naturopathic doctor, or I'm in support of naturopathic doctors prescribing. Let's keep it that simple. That's the thing. A lot of times people say, my naturopathic doctor is fabulous, and they're really, really good. And I like that, but it doesn't help.
We need clear,
it doesn't make the point.
Concise point. My naturopathic doctor should have prescribing rights.
Yeah, prescribing rights. That's what it is. Should have prescribing rights. And it's helpful to give an example of when you really needed prescribing rights and couldn't get it, and you had to go somewhere else. Honestly, this is, when you really get down to it, this is an access to healthcare problem. Another way of saying that is it's your life depends on it, but it also is a matter of convenience, because the way the system's set right now is my patients I have to send away.
Nobody. There's nobody to take them.
And there are people who need medications. They are sick enough that right now, maybe in the long run, eat right and exercise is going to be a solution for you, but the long run, we don't have the long run. We got to fix this right now, because you're not going to make it a week.
Yeah.
Unless we get some medications to shut down this reaction that you're having, right? People get reactions to things. Mm-hmm. And so we need to have the medications to deal with those reactions. Or you need an EpiPen, because if you get into eating peanuts again, right, this may cause you to die, and you got that last peanut exposure by accident, so we need to have you carry an EpiPen with you. That kind of thing. Now, in the past, I just wrote a prescription for an EpiPen. I've had prescription rights.
Yeah.
I've practiced places where I just wrote a prescription. So it was easy.
And that was in Arizona
here, I
and
say,
Oregon?
You need an EpiPen. I wonder where you can get one. Because you can't get one from me. We got to figure out where else you can go. Do you know anybody? That's usually how it starts. Do you know anybody?
Or I can think of our diabetic patients who might need insulin pumps.
Yeah, right. Same thing. Or just insulin for that.
Yeah, or insulin, exactly.
So there are many.
Our Medicare patients who you need to order labs for, and Medicare won't cover their lab work if you write the order. So then they have to go to their primary and get an order from their. Yeah. So anyways, there's a lot of opposition to this. There's a lot of money and a lot of push. The biggest opposition we have right now is a fellow by the name of Zach Fields, Representative Fields from Anchorage, and he is basically the go-to guy for the State Medical Association to block us. He's co-chair of a committee that's coming up for us to get through, and he's
stated unequivocally that he is against our bill and doesn't want it to go through. He's heard all our experts and has stuck with it. I asked him personally, I said, why are you against this? He said, because my neighbor doesn't like this bill, and my neighbor's a doctor. And he said not to vote for it, so I'm not voting for it. That was what he told me. And I was like, well, Ken, is there any way we can...
Talk to your neighbor?
Well, maybe we could give you information that would address your concerns.
Yeah.
You know, like we could show you the records on safety and show you that naturopathic doctors have historically been safe, more safe, in fact, with fewer problems than MDs and DOs. We could show you that that safety record is recognized by the insurance companies. You know, and they're not, you know, they're in it to make money. They just want to assess your actual risk, and so that's what they've done. They've assessed the actual risk, and they realize that it's going to cost them less to have malpractice insurance, to be able to provide malpractice insurance for naturopathic doctors. So they charge less. You know, it's just because they're safer. So these are compelling arguments for safety. The other thing is there's a definite doctor shortage here in Alaska.
Yeah.
And we have 40, I realize there's not that many, but 40 trained physicians in place ready to go. All we need to do is flip a switch. We don't have to change anything. We just need to
who already have the education.
They already have the
training.
education, they have everything ready to go. All they need to do is just get the legislature to let them do it, like they do in Oregon and Washington and California and Arizona, so on and so forth. All these other states do the same thing.
Well, Dr. Luper, thank you for talking about this morning. I think it was very important for our listeners to know what's going on with our medicine and our healthcare rights.
Haley, I really appreciate you twisting my arm, making me do the show.
Yeah,
because I'm always about, the show should be about how to be healthy.
Right.
And you've been pushing me for weeks
No,
to do this.
Is definitely something that
did.
everybody needs to know about, especially if we want to change our healthcare and take it into our own hands and be more preventative.
Thank you.
Thank you, Dr. Luper.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.